We are proud to introduce RehabMaker, community-based initiative project in innovating and developing products to help people living with disabilities. We consist of experts working hand in hand in developing assistive adaptive device, or shortly known as AAD, to reduce disabilities, encourage participation and improve overall well-being. Assistive adaptive devices, or shortly known as AAD, is one of the interventions to assist people living with disabilities or PWD to perform activities of daily living and reduce dependency level. World Health Organization WHO survey has reports that globally, 1 billion people need one or more assistive products. However, accessibility to AAD is limited to only 5 to 15% in middle and low-income countries. As a reaction to this problem, WHO has declared accessibility to AAD as a human right. Acknowledging the increasing number of PWD that needs AAD, recent United Nations Convention has included the accessibility to assistive technology into its action plan. In Malaysia, the total reported number of PWD registered at the Department of Social Welfare in 2017 was about 453,258 persons. PWD with physical impairment has been recorded as the highest number, which was 35.2%. Disabilities are very diverse, which depends on the pathophysiological background, disease and needs. PWD will have problem in performing activities of daily living, hence, reduce their independency level. AAD prescription is one of the interventions to address impairment and improve dysfunction, hence, independency level can be optimized. It is very crucial for the AAD to be customized in order to conform and amiable to a specific impairment. However, in our local clinical setting, AAD prescriptions is limited and only address certain function. This is due to 1. Lack of idea, limited skills, material, outdated designs and production and designing method. 2. Lack of structured multidisciplinary or transdisciplinary framework. The designing and development of AAD involve a few processes that consist of 1. Clinical assessment. The impairments and disabilities of a patient are determined by the rehabilitation physician. The findings are then discussed with the engineers to allow in-depth understanding about the problems. The assessment also involves in capturing the anatomical features of the patient. 2. Specific functional goal is discussed with the patient and the whole team. The goal must be specific, measurable, attainable, realistic and timely. The goal must be agreed with the patient and team members. This is important to ensure the developed AAD serve the intended function. 3. The product was designed using CAD or CATIA software. Appropriate materials are selected. The fabrication of the product will mainly utilizing 3D printing technology. 4. The developed AAD will be tested by assessing the donning and doffing technique, safety and its function. Any problem is identified during this stage, and will be rectified. 5. Further assessment on functionality of the product will be measured by validated outcome measures or video. The novelty and advantage of our project are: 1. We adopt co-creation concept by involving patient in active decision making. 2. Utilizing technology in the RD of overseas customization. 3. Increase the digital data storage for future development. 4. Able to fabricate without MOQ. 5. Customizable for specific impairment and disabilities. 6. Cheaper, faster fabrication time and amiable designs if adjustment required. 7. Limit and reduce excessive usage of plastic and material used is recyclable. 8. Upgrading current service of AAD prescription in rehabilitation medicine. This project drives the country towards the agenda of globalization in achieving sustainable development goal under good health and well-being, industry innovation and infrastructure, and to reduce inequalities. Introducing 11 RehabMaker minimum viable product, in short, MVP. Tenadesys gripping enhancer orthosis. Awarded gold medal in ITEX2019 and MTE2020. It is developed to enhance the gripping force in patient with hand weakness who suffered from spinal cord injury. Before the orthosis, patient is having difficulty to pick things up. One of the patient is a high school student that requires an adjustable wheelchair-mounted customized table to ease patient to perform writing activity on wheelchair-bound patient. The patient also required customizable hand orthosis that act as pen or spoon holder and harness for easier wear. This large hand grip improve a hand gripper by improving the grip for stroke patient that has weak hand. The old device used was not reusable and permanently attached to one pen. The gripper also can be attached to hold a spoon. This plate base rotator help patient who have poor hand control to eat on a plate. It helps the patient to manipulate food component on the plate whilst eating and improve independency. The system use basic ratchet mechanism. This is a prototype of transtibial socket for lower limb prosthesis. We improvised the technique in the socket fabrication using CAD software and 3D printing technology. It is still in prototype phase. An adjustable ankle foot orthosis. This AFO has an additional features of adjustable force and angle compared to the conventional AFO. It is prescribed for patient who suffers from ankle joint stiffness resulting from stroke. This is a mounted headrest to provide head control for cerebral palsy child. The alternative for conventional splint for wrist support, using PLA material instead of thermoplastics. This writing aids provide assistance for stroke patients to perform writing activity. The wheelers help the patient to have horizontal and vertical stroke whilst writing. This is a cosmetic lower limb prosthesis that improve patient's body image and further enhance patient's confidence level. This is a prototype hand orthosis for patient with congenital limb deficiency. This is palm joystick attached to mobile phone or tablet to help manage the cursor. Our achievements are patent filing and copyright, publications in index journals, gold awards in international and national innovation expos, featured in local media and some CSR activities. We can also be found on digital platform for our products and services. And lastly, thank you for watching.